Strokes can happen to anyone and they impact nearly 800,000 Americans every year. While treatment options have come a long way, recognizing the early signs can still make all the difference.
That's right. Joining us to discuss from Tulane University School of Medicine is neurosurgeon Dr. Kendrick Johnson. Thanks for joining us. We appreciate it.
Thank you for having me. It's such a pleasure to be discussing this important topic on Stroke Awareness Month.
Yeah,
Absolutely.
it is, absolutely. So maybe just fill us in with some basics here, Doctor. What is stroke and how common really is it?
So, like you said, unfortunately, stroke is very common. About 800,000 Americans have strokes every year. It's estimated that every 40 seconds, someone in the United States has a stroke. And unfortunately, as well, about every 3 minutes, someone dies from a stroke. And all stroke is simply put is a disruption to the blood flow in the brain. One type of stroke is a blockage of the blood flow to the brain, typically from a blood clot. The other type of stroke is a bleeding into the brain from a leaking of a blood vessel. The vast majority of those, however, are the blockage or blood clot type of stroke.
I'm curious, are there any symptoms that people should watch for, or maybe something that they would not expect is a symptom?
Okay, so that is one of the most important messages we can put out there are the signs and symptoms of stroke. And the easiest way to remember those are the acronym FAST, F-A-S-T, where F stands for facial drooping, usually one side of the face drooping as opposed to the other. A stands for arm weakness, one arm weaker than the other, or same goes for the leg. S stands for speech, meaning difficulty producing or understanding speech. And the T stands for time, meaning that if you recognize those signs and symptoms, it's important that you call 911 right away.
You know, I love that. Putting it into an easy to remember acronym is really
Absolutely.
smart. Yeah.
Yeah.
You know, I know there have been advances over the years in medicine, obviously, and I'm curious about some of the biggest advances we've seen in stroke treatment recently.
Yes, sir. So stroke is one of the leading causes of death and disability in the United States. So it's been a major focus of research and innovation from a medical and procedural standpoint, all the way from the clot busting medicine that you can get if you go to the emergency room in the appropriate amount of time. But what drew me to this space is a procedure called mechanical thrombectomy. It's something that's been developed over the last several decades where we can essentially stop a stroke in its tracks. If somebody comes with a blockage of one of the large blood vessels in the brain, and they get to us in time, we can go minimally invasively through the blood vessels in the brain all the way up to the brain with a small tube called a catheter and either suck the clot out or pull a clot out. And what the goal of that procedure is to turn what would have been a large stroke that potentially can kill a patient to a much smaller stroke that they can more completely recover from.
That's amazing.
Wow.
That's absolutely
That's
amazing. I love that
crazy.
technology.
Yeah, absolutely. Who's most at risk for a stroke, and what can people do to maybe lower that risk?
So interestingly, stroke can happen essentially at any age, all the way from infancy all the way up to the elderly, although stroke risk does increase as we get older. The biggest risk factors for stroke are the somewhat basic medical conditions, meaning persistently elevated blood pressure, high cholesterol, uncontrolled diabetes or poorly controlled diabetes, obesity, and smoking. The biggest way to help reduce those risks are working with your medical doctor on a regular basis to help reduce those risks. Also, increasing our physical activity helps greatly reduce the risk of stroke as well as quitting smoking.
Yeah, that's
That's
great.
good to know.
Where can
Yeah.
we go for more information? Maybe if we're curious about any of the things we've talked about here today, Doctor.
All right. So I've partnered with a company on this initiative called Penumbra, one of the leaders in the neurovascular space, and they have great patient-facing resources. Their website is penumbrainc.com/stroke. Another place you can go for information, if you just Google the term no stroke, KNOW stroke, the National Institute of Health as well as the Center for Disease Control has great a wealth of information with regards to stroke education and awareness.
Great. Thank you so much for
Thank you
joining us,
so
Doctor. We
much.
appreciate your
Yeah.
time today, raising awareness about this very needed and special topic
Yeah.
during Stroke Awareness Month, for sure. Thank you.
Definitely.
Thank you guys for having me.
Absolutely.
Yeah.
Yeah.
Good to know that stuff.
It's really good. You know, I've had family members affected by stroke, loved
Totally.
ones affected by stroke, so it's good to know that we're making advancements in treatment as well. I loved
Yes.
that interview.